Have you ever wondered why certain medications can sometimes leave you feeling more drained than a marathon runner at the finish line? It turns out that some of the very pills we rely on to keep us ticking can have a sneaky side effect: anemia. Anemia is no joke, and sometimes the medications we rely on for various health issues can unexpectedly contribute to it. In the United States, there is a lineup of commonly prescribed drugs that have been associated with anemia. Let's take a closer look at these medications. Anemia, often referred to as a silent condition, can manifest in various symptoms that may initially go unnoticed or be attributed to other factors. One common symptom is fatigue, where individuals may feel unusually tired or lethargic even after adequate rest. Shortness of breath, especially during physical activity, can also be a telltale sign of anemia as the body struggles to transport oxygen to tissues efficiently. Let's take a look at these medications that can cause anemia. Number 1. NSAIDs, non-steroidal anti-inflammatory drugs. NSAIDs like ibuprofen and naproxen are often our go-to for pain relief and fighting inflammation. However, these handy meds can lead to gastrointestinal bleeding, resulting in chronic blood loss and anemia. The typical dosage ranges from 200 to 400 milligrams every 4 to 6 hours for ibuprofen to 220 milligrams every 8 to 12 hours for naproxen. Take NSAIDs with food or milk to reduce the risk of stomach irritation, following your healthcare provider's instructions closely. Keep an eye out for stomach upset, ulcers, and potential kidney issues with long-term or high-dosage use. Number 2. Anticoagulants, blood thinners. Anticoagulants like warfarin and heparin are crucial for preventing blood clots, but they come with their own set of risks. Sometimes, these meds can cause excessive bleeding, leading to iron-deficiency anemia. Dosages are personalized based on factors like clotting levels, requiring careful monitoring and adjustment. Stick to your prescribed regimen and keep a close watch on any signs of bleeding or bruising. Bruising, bleeding, and the occasional hemorrhage can occur, especially with prolonged use. Number 3. ACE inhibitors, angiotensin-converting enzymes inhibitors. ACE inhibitors such as lisinopril and enalapril are essentials for managing conditions like hypertension and heart failure. Yet, they can sometimes interfere with erythropoietin production, leading to anemia. Dosages vary depending on individual health needs and responses to treatment. Take these meds as prescribed and keep track of your blood pressure levels regularly. Watch out for a pesky cough, dizziness, or potential kidney issues, especially with long-term use. Number 4. Chemotherapy. Chemotherapy is a powerful weapon against cancer, but it can have collateral damage on red blood cell production. Certain chemotherapy drugs can suppress bone marrow function, causing a shortage of red blood cells and subsequent anemia. Treatment plans are highly personalized depending on cancer type, stage, and individual patient factors. Leave this one to the professionals. It's typically administered intravenously in a clinical setting. Nausea, hair loss, and increased susceptibility to infections are common, with anemia potentially exacerbating these symptoms and necessitating additional interventions like blood transfusions. Number 5. Antibiotics. Antibiotics are our knights in shining armor against bacterial infections, but they can sometimes wreak havoc on red blood cells. Some antibiotics, like sulfonamides and cephalosporins, may cause hemolytic anemia by prematurely destroying red blood cells. Dosages vary depending on the specific antibiotic and the severity of the infection. Take antibiotics as prescribed, completing the full course even if symptoms improve. Keep an eye out for gastrointestinal upset, allergic reactions, or more severe adverse events like Stevens-Johnson syndrome. Number 6. Antidepressants. Antidepressants help lift the fog of depression and anxiety, but they can sometimes throw a wrench into red blood cell production. Certain antidepressants may inhibit bone marrow function, leading to anemia. Dosages are tailored to individual needs and may require some trial and error. Follow your healthcare provider's instructions closely and allow time for the medication to take effect. Common side effects include drowsiness, dry mouth, and potential weight gain, with mood disturbances requiring careful monitoring. We made a book, 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to check it out. Number 7. Antacids. Alright, let's talk antacids. These little lifesavers are your go-to for neutralizing that nasty stomach acid and calming down indigestion. But here's the kicker. If you're popping them like candy for too long, they might mess with your iron absorption, leading to, you guessed it, good old anemia. So if you're reaching for these, keep an eye out for any changes in your bathroom habits. And don't hesitate to check in with your doc if things start feeling off. Number 8. Diuretics. Now onto the diuretics, aka water pills. These guys are like your personal plumbers, helping flush out that excess fluid and keep your blood pressure in check. But here's the catch. Some diuretics can flush out more than just water. They can also take away precious potassium and magnesium, which are key players in red blood cell production. Keep an eye out for any unusual bathroom habits or muscle cramps, and don't forget to hydrate like it's your job. Number 9. Proton pump inhibitors or PPIs. Proton pump inhibitors or PPIs for short are the go-to for heartburn. Once taken, they soap in, shut down those annoying acid pumps in your stomach. But here's the thing. If you're taking these regularly, they might mess with your iron absorption, leaving you feeling a bit more tired than usual. So if you're reaching for the PPIs, keep an eye out for any changes in your energy levels and don't hesitate to chat with your doc if something feels off. Number 10. Anti-seizure medications. Last but not least, let's talk anti-seizure medications, also known as anticonvulsants. These meds help with seizures, keeping them at bay and giving you some peace of mind. But here's the deal. Some anticonvulsants can mess with your folate metabolism, leading to megaloblastic anemia. Keep an eye out for any changes in your energy levels or mood. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life!